Dr. Lai, what are we learning about patients with untreated AML who are ineligible for intensive chemotherapy?
To define ineligible for intensive chemotherapy, I think that is a moving target, because historically we would define patients as eligible for intensive or less intensive chemotherapy based on an age cutoff. And as the population is becoming more fit and is also getting older, what I would like to say is that we should use physiologic age, not chronologic age, to determine who is eligible for intensive chemotherapy. And that is, in terms of how that is assessed, that is not uniformly done. But in general, it takes into account how active a patient is and what they're able to do on a day-to-day basis. So mostly their physical function. We also take into consideration their cognitive function as well, but to a less extent. So for patients who are ineligible for intensive chemotherapy, the standard practice would be the combination of azacitidine or decitabine, both of which are hypomethylating agents, in combination with venetoclax. And that combination has really changed the landscape in terms of how we treat patients. It can be given as an outpatient, so it's much better tolerated and has fewer side effects compared to intensive chemotherapy. So the activation tip here is to talk with your physician about how they will determine whether or not you are fit or unfit for intensive chemotherapy.